For the 24 hours starting on Friday, August 21st, we identified 83 new cases and 2 deaths. The provincial lab completed 10,175 tests. For Saturday, August 22nd, we identified 106 new cases and no new deaths. On that day, there were 10,098 tests completed. Finally, over the last 24 hours, we detected 69 new cases and 2 deaths. There were 8,489 tests completed. My sympathies go out to all who lost loved ones this weekend, whether to COVID-19 or any other cause. Today, there are 1,172 active cases in the province. 45 people are in the hospital, including 9 in intensive care. In all, 11,600 Albertans have recovered. I also must report several outbreaks of note in the province. Before I list these outbreaks, I want to emphasize that each one of these locations is working closely with public health to prevent further spread. It is imperative that these locations and their employees not be stigmatized or targeted because they are being transparent and proactive. Sharing this information ensures we are communicating with the public about trends. Unfairly targeting any worker or activity participant is counterproductive and risks driving COVID-19 and sickness underground. Those involved in any of these outbreaks are cooperating with public health to limit the risk of spread to others. At health facilities, the Peter Lougheed Centre in Calgary currently has 5 active cases. The Grey Nuns Hospital in Edmonton has 2 active cases. The Good Samaritan Southgate Care Centre now has only 3 active cases and 80 recovered cases. Sadly, 2 of the deaths over the weekend were at this facility, bringing the total deaths there to 31. At religious gatherings, the event in Deadwood near Manning is now linked to 7 active and 10 recovered cases in Alberta. The Bible Pentecostal Church in Edmonton now has 75 active cases with 2 recovered. At workplaces, the Lilydale Chicken Plant in Calgary has 11 cases and 2 recovered, and the Cargill Case Ready Plant has no active cases. Alberta Health Services has confirmed 3 positive COVID-19 cases in staff members of the HealthLink team. Contact tracing is underway, and there is no significant staffing impact to HealthLink at this time. I note that Edmonton still leads the province with 631 active cases. As we've seen Edmonton numbers rise, I've received many questions from Albertans looking to understand why. I have been working with my team to find out more about what is happening. Today, I can share some details on trends we're seeing that contribute to these numbers. The reasons are not new, and there is no one single factor. Primarily, we're seeing growth in cases linked to gatherings, weddings, funerals, family reunions, prayer meetings, informal gatherings of friends, backyard parties, and community groups. There has been a particularly high attack rate in family gatherings. Social connection is vital to our mental well-being, and I know that we have all missed these activities immensely. While children are less likely to have severe outcomes with this virus, they can pass it on to older family members who are more susceptible to severe outcomes. Albertans have a civic responsibility to protect our elders, which unfortunately means considering moving to virtual visits with Grandma and Grandpa as school starts up. While this is a sacrifice, and it may be hard for grandparents, parents, and grandchildren, it is the right thing to do to have these conversations as we move into this next phase of reopening. In addition to encouraging safe gatherings, I would also like to speak directly to younger adults today. It is easy to feel invincible and believe that COVID-19 is only a concern for older Albertans. It is easy to forget the virus's potential to cause harm if you don't know anyone who has suffered from it. It is easy to believe this is someone else's issue. You are less likely to have severe outcomes from a COVID-19 infection, but because of the way the virus is spreading in your age group, you are now more likely to pass on this virus unknowingly and to do so rapidly. We are seeing this in Edmonton right now. When we let our guard down, the virus has its opportunity. It is possible to hold a safe gathering, and when we do, we must be diligent in ensuring proper infection control protocols. Keep gatherings small and meet outside rather than inside whenever possible. Asking someone to wash their hands or reminding them to maintain 2 meters of distance is the most loving thing we can do for each other at the moment. I also urge the hosts of any type of gathering, big or small, to keep a written list of attendees for at least 2 weeks. It may seem silly to write down which family members come over for a visit, but quick access to accurate information speeds up contact tracing immensely. One thing I'll say, not necessarily from our own experience, but what we've seen in other jurisdictions, is that there does seem to be a link to things like smoking or vaping and having a more severe outcome following a COVID-19 infection. So it's a good reminder for those who are interested in cutting down or quitting those activities to look at the supports that are available, like the Alberta Quits Helpline, and consider ways to, especially for those, obviously this is more for those who are teens who are vaping or smoking, that this is a great opportunity to think about supports that are available to them to quit, to reduce the chances that they may have a more severe outcome should they become infected.